Hey everybody, Dr. Dave Marquis here, and I wanted to touch base on a kind of a broad topic. It has to do with primitive reflexes. And you hear that term reflexes, and commonly you'll think of when the doctor comes out and they take the hammer and they whack you in the elbow or in the knee. And those are reflexes, but those are deep tendon reflexes, and that's a whole nother topic. This one has to do with looking at a set of reflexes that are actually there to help us through the first few months to up to about a year of life. A couple of them actually extend up to about age 3, but for the most part, they're just there to help us through those first few moments in life when we're starting to develop. Matter of fact, some of them are actually designed to help you get out of the canal if you're born vaginally. And when an individual is a C-section baby, sometimes that is carried forward with them because they didn't have that opportunity to actually use it, which will be a kind of a recurring theme as I go through this. It's one of those things where if you don't use it, you lose it, and sometimes it's retained, and it's kind of like baggage in your backpack. Primitive reflexes can inhibit your ability to develop normally. And what I mean by that is, if you've got this set of neurological tools that are inborn and they're not getting taken out neurologically, the next step of development can actually become obstructed. That's part one to this. Part two is sometimes we do too much for our kids. And oftentimes it's the middle child. I think about different families that I know, including my own, and I was aware of this at the time, so I kind of forced my middle kids to work a little bit harder because I didn't want this to happen to them. But just out of convenience, oftentimes we don't let them crawl. We don't let them do a lot of floor work just out of convenience. You know, you got everybody running off to school or to the store or church or whatever it might be, and so you grab them, and they're just kind of your football, and you're walking around with them, and they get accustomed to that. They're like, well, you know, if I don't have to work, why am I going to work? And so they grow chronologically in age, but they missed out on these opportunities to get on the floor and actually cross-crawl and develop some of those pathways that would allow the brain to enhance its decussations so that the left brain and the right brain can start to talk to one another. So when you see them in childhood, some of these individuals, and adulthood, some of these individuals that have manifest persistent primitive reflexes may have a hemispheric dominance where they tend to be a little more left brain versus a little more right brain. And some of the things that you'll see with that actually can play out in other areas of life, like our immune system, for example. When you see an individual that has chronic ear infections or a lot of food allergies, or they have a really sensitive tongue or palate or stomach, you'll be able to observe that they're going to have a dominance on one side of the brain over the other one. So testing for that by looking at the primitive reflexes and kind of going through the different steps to evaluate what side tends to be dominant for you helps you to have a tool set to retrain that individual so that they can get past that. So today, I'm trying to be succinct without going into too much detail, but I want to break down just a handful of these reflexes. So, since I said hand, I'm going to start with the palmar grasp. If you have a baby that has this reflex still intact, you'll stick your finger out there and have them grab onto it, and they'll hold on for dear life. Matter of fact, you should be able to pull them up if that reflex is still intact. And when that one persists into childhood and adulthood, you'll tend to have poor manual dexterity, difficulty with writing in a clean fashion, so you'll be a sloppy handwriter. It can extend into other aspects of life academically in terms of how you learn. The remediation of that reflex, or the testing for it, is actually just running your finger or a blunt object from one side of the hand to the other. And you can kind of make a cross, you can go across the palm. And if somebody still has that reflex intact, you're going to see their hand it'll start to curl a little bit. You'll see the fingers or the thumb twitch a little bit. It doesn't have to be a full grip, but if they're unable to involuntarily keep their hand flat without any type of movement, then there's part of that reflex is still intact. The remediation of it is actually doing that task. So you can take a brush, you can use your finger, you can use the blunt edge of a pencil, so the eraser, and you do that task, and you just run it across those tissues until the patient starts to become desensitized to that. Don't expect it to happen in one visit. It usually takes weeks of doing that, and you do a little bit at a time. The nervous system really learns by small bits and pieces. The saying that I like in regards to this concept is, nerves that fire together, wire together. And so the more often and frequently that you can allow a nerve to fire, you're going to enhance that pathway. So that's one. The next one that I'll refer to is the rooting reflex. And this initially helps a baby to suckle, to find the mom's breast and latch on. And babies that are born prematurely oftentimes don't have a strong rooting reflex. It hasn't fully integrated, and they have a very hard time latching on. Well, testing that one is simply running your finger or something blunt, again soft, basically from the nares, the edge of the nose, down to the edge of the mouth. And when they do that, you'll commonly see them pucker, or their mouth will move a little bit, or they might even stick their tongue out a little bit. The deficit in carrying that one forward has a lot to do with tactile sense. Folks that have this one still intact are going to be really sensitive to the taste and texture of food. And they may also have speech impediments where they have a difficult time moving their tongue in a smooth fashion. They can also have actual speech deficits where they're a late speaker or unable to speak developmentally. And interestingly, simply by treating that region or stimulating that region, and there's also some laser therapies that I've seen do some amazing work where they'll use a laser over on Broca's Speech Center while simultaneously stimulating that reflex, that the child can begin to articulate and gain function in that manner. And it's not just from the nose to the cheek. You can also go straight from the ear down to the cheek, but it's basically something related to the cheek in a soft touch, and you'll see the baby or the individual root. They'll actually turn their head to that side, and their mouth will pucker a little bit. Again, it doesn't have to be a profound puckering like they're going to kiss you, but any type of movement or inability to refrain from movement. Sometimes you'll see this intact in individuals where they're in deep thought and they're doing another task, they'll stick their tongue out. There's a lot of athletes that you'll see actually do this, where they're in the middle of carrying out their sport and their tongue's hanging out. Not because they're hot or tired, but because that reflex is still intact. Kind of interesting when you actually watch people and you can start to pick off some things that they could work on, and you wonder, wow, if they're that good, I wonder how good they'd be if they, taken some of the reflex and helped them to remediate it. So that's palmar grasp, rooting. I'm going to get down on my hands and knees now, and I'm going to show you a couple others. The first one is the asymmetric tonic neck reflex. And that one has a lot to do with our ability to learn, our ability to digest. It's one that has a lot to do with the cross-body patterning. As a matter of fact, the way that you're going to remediate it is that. So you would get down on all fours, and you would have the patient, and you can actually have the individual testing them turn their head. And if they turn their head and their elbow turns as they turn away, you know that reflex is still intact. Now, if that is still intact, the easiest way that you can help them to remediate that one has to do with doing some cross crawl patterning. So the lizard is one of our favorite activities for that, where when you're on all fours, and maybe I'll have Tom come help me on this one, because if I lay down, this mic is going to make a lot of noise. The goal is to take same knee, same elbow, and bring it to the side, and then alternate. So as his head turns, his body is going to have this asymmetric reflex, where two limbs are coming together, head rotates, and the opposite limbs extend. Now, another pattern that you can do, go ahead and turn over, Tom, is called the Starfish, and then there's another one that is Snow Angel. And all three of these will come up with a few different reflexes, including the Moro, the spinal galant, and this tonic neck, asymmetric tonic neck reflex. So if he was to do the, yeah, go ahead and turn that way. There you go, perfect. If he was to do the Starfish, let's go ahead and do that one. You're going to cross same side over simultaneously. So he's got his right leg crossed over his left, and he's got his right arm crossed over his left. And then what he's going to do is he's going to open that. Perfect. And then he's going to close it back up. And he's going to open that. And close it back up. Now you can give them a metronome count to do this too, which actually accentuates the task. You can use a vibratory stem along their chest or on their spine while they're doing this task. You can have them seated and do it, so you can change the angle of position. I've had some patients where they'll do that on a vibrating plate, where they'll open and close like that. You don't want to fatigue somebody too much with any one of these, so you'll do about 10, and then you would cross over and he would do the opposite. So it's going to be left over right. And again, open, good, and close. Perfect. Now what you'll see when it's intact is the patient will tend to cross opposites, where their right arm or left arm would cross over while the opposite leg, they have a hard time keeping that symmetry, in other words. And so that's what you're looking for, to make sure that they're able to keep those moving in the appropriate fashion. Now Starfish, no, excuse me, that was Starfish. We're going to do a Snow Angel. There's a couple of different ways that you can do this one. And in a similar method where you're kind of alternating sides, you can be linear. So go ahead and bring both arms and legs together. There you go.
No, like this?
Yeah, you can start at the top or you can start at the bottom. If you're starting at the bottom like that, so we're going to open both. Perfect. And close them down. Excellent. I like to do this one to a metronome. If you can have a very slow pace, so they move in a staccato fashion all the way up and back down. It allows them to start to master some timing, and that actually integrates the auditory cortex, which forces some crossover, because our ears hear in a 60-40 or 60-40 fashion, right to left, left to right. And when you're doing that and you're moving it, you're integrating multiple brain regions at the same time. And you could actually do the opposite, where you have the arms open, legs closed. Yep, perfect. And back, good. So giving the body a task well defined that the patient understands that they can play out to a beat works really well with that. Now, if you have somebody that doesn't know their right from their left, you could actually put stickers on and say, okay, I'm going to use the green sticker on the right hand, green sticker on the foot, and so you're going to put, okay, green over whatever color you have on the other side, and that would work well for them. Now, I mentioned two others, and since Tom's here on the floor and he's already doing this, I'm just going to tie in those other two reflexes. So spinal galant, if you could just turn over and go on all fours. This one, I'm going to lift your shirt up if that's okay. You'll actually take some type of blunt object, I'm just going to use my finger, and you'll run down the spine. And not having the reflex would be exactly as Tom just did right there. But if he were to, I'm going to have you twitch to this side, you'll see a subtle twitch to the side that you're doing a little bit of stimuli on if the spinal gland is still intact. This is one that is very commonly still intact in kids who are still wetting the bed past an age that you would expect that they'd have that self-control. You'll commonly see this one in individuals with digestive issues as well, and impulse control. The next one would be the Moro Reflex, and the Moro Reflex is actually a startle reflex. Many times you just kind of get a sense for this one as you're talking to an individual because it's very close to the fear paralysis reflex. And so when you're talking to an individual and in their history, you get a sense that they have a tendency towards fight, flight, or anxious behavior, or if they even put it down in their history, they're here for anxiety. It's not uncommon that they're still holding on to some of this reflex patterning. And it can manifest in a lot of different ways. The Moro and the fear paralysis can be strongly associated with individuals who have been labeled with ADD or ADHD or focus and attention issues, but also with individuals who suffer from depression, have a difficult time with interpersonal relationships and making friends, individuals that are again, this is looking at the immune system side, prone to allergy and inflammation in that sense. And so those same 3 exercises work really well for the Moro and the fear paralysis. And also one that we like to do that's a little bit more active, and I'll have you stand up. And you'll ask the individual to do either a pigeon toe or a duck toe, and you'll just watch them walk and see what they naturally do. So if I had Tom take his feet and do a pigeon stance, I just have him walk a little bit, and what I'd be looking for is to see what his hands are doing. And now he's had ample time to practice this one, so he's doing pretty well. But what you'll commonly see if somebody still has this intact is that when they toe out, their hands will commonly go out, and it'll be really awkward for them. And they don't even know that they're doing it, but they're like looking down at the floor, making sure that they're still able to walk because it's a different type of a gait for them. You have them toe in, and you'll find that their arms actually internally rotate in that moment. And it's hard for them to undo that. So the task then is to try and disconnect upper body from lower body. And so if he's pigeon-toed, I'm going to have him actually try and internally rotate and try and walk as normally as possible, allowing the body to start to regain a semblance of rhythm while inhibiting that reflex. And then you can layer tasks on top of that by having somebody walk down a hallway where they're focused at a distant object or another individual, and you can bounce a ball between them while they're doing this type of a gait. And it allows for timing to be engaged as well. And you can layer on top of that even the metronome again. So that covers Moro, fear paralysis, spinal galant, asymmetric tonic neck reflex, rooting, and palmar. That's a good start. If you're engaged and aware of all of those and you've remediated them, you're doing pretty well. There's a few others that are overlapping on some of these, like the Landau reflex for posture. Actually, let's go ahead and do that one. So go ahead and lie on your tummy. And then what I'm going to have you do is kind of do the Superman. So bring your arms out in front of you. Yep, perfect. Now, you see how Tom's able to keep his feet and hands and spine all erect like that? In the Landau, he wouldn't be able to keep his feet off the ground right there. And so by having him engage his erector spinae and hold that has a lot to do with midline cerebellum and our ability to focus and pay attention and actually sit up straight. And ultimately that plays a role in how well you oxygenate yourself, which I've kind of talked about in other videos on the heart rate. You're doing awesome, Tom. Thank you. So take a look at your primitive reflexes and realize that there's so many ways in life that these things can play out to kind of bite us later on. It can affect your immune function. It can affect your mental attention. It can affect your sleep patterns. It can affect your posture, your gait. your dexterity, your ability to learn and acquire new sporting skills. All of this goes right back to how we originally were developing or not. And so I would encourage anyone who's interested to take the time to have these primitive reflexes evaluated and realize that it's one more piece of the puzzle of your health. For many of the people that we do like neurofeedback with or some of the metabolic work, it augments that to help to tie together the performance of their central and peripheral nervous system. I hope that was helpful and informative to each person who watches this. Have a great day.